Again, welcome to the EHR Incentives presentation. Again, my name is Felicia Copany, and I will be presenting today's webinar to you. We're going to go over some things just to help you get started on registering for the EHR incentive. Today's webinar presentation is for providers, administrators, office managers, billers, or anyone responsible for the application process. The presentation overview, basically what we're going to be going over is to get you ready for your registration and attestation. We will give you instructions in 3 steps, so we're going to break down everything in 3 steps for you. We're going to show you where to go for information and questions on the Medicare website. We're going to give you an overview of the attestation process and what that means, incentive qualifications, and we're going to show you the questions or facts page on the Centers for Medicare and Medicaid website. What is an EHR incentive? Basically, what the EHR incentive is for eligible providers or eligible hospitals who have successfully adopted a certified electronic health or medical record. The certification of all EHR programs was intended to ensure that providers and hospitals would have the necessary tools to apply and successfully meet the meaningful use measures. E-Medical Notes as a certified EHR has met the meaningful use measures. The standards for these measures were set by Medicare. This means that providers using the certified version of EMN can now demonstrate meaningful use in their practice through those measures. It is through these measures of a certified EHR that will qualify your practice for the incentive. If you have not implemented the full version of our certified EHR and or have not made use of the certified version after 3/25/11, which was our certification date, you will not be able to demonstrate meaningful use. For the Medicare EHR incentive, to qualify for the first incentive, you must use the certified EHR for 90 consecutive days. At the end of the 90-day period, you can attest on the Medicare website. Now, the 3 steps that you should take in this process. Step 1, you should go ahead and register. Step 2, you should learn how to navigate the CMS website. Step 3, review the CMS EHR section of the site. Now, here's your step 1. This is what the registration page on NIPS looks like. You're going to have to obtain your NIPS login and password. What this website is basically when your practice signed up or your provider signed up for their NPI numbers, this is the site they went to sign up for it. So you're going to have to obtain that first before you can get onto the CMS website and register. If you do not know your login and password, there is a number you can call on NIPS website. You can reset your password there as well. Once you have obtained your NIPS login and password, please write it down. This will be your Medicare EHR incentive login. This should be done before going to the CMS website, as I stated before, because you will not be able to go through the process without it. If you know your login, you can move on to the CMS website. This is the home page of the CMS website. On this home page, there is a banner. It is called Act Now. Click on this banner and it will take you to the EHR web page. This is what the EHR incentive section of that website looks like. There are 15 sections on this page, and each have pertinent information pertaining to the EHR incentive application process. On this webpage, there are 15 subsections that you should explore. The first one is overview, path to payment, eligibility, registration, certified EHR technology, CMS EHR meaningful use overview, attestation, Medicare and Medicaid EHR incentive program basics, Medicaid state information, Medicare Advantage, spotlight and upcoming events, educational materials, EHR incentive program regulations and notices, CMS EHR incentive programs, and the frequently asked questions page. Now, step 3, reviewing the CMS EHR section. Some of the information in this section includes what the EHR incentive is. It describes the terms EHR versus EMR, Medicare versus Medicaid incentive, and important dates to remember. You want to go over this last step in detail. This is the actual EHR incentive section on the CMS website. So you want to go over this section as much as possible. So let's go ahead and discuss each one of those subsections. The overview subsection, while each part of this is important, I would like to briefly discuss the overview. The Medicare and Medicaid EHR incentive program section explains the difference between the two programs. First, there is a difference in payment. For the Medicare incentive, you could receive up to $44,000 over the next 5 years. Also, if you are an eligible professional or hospital who by 2015 has been found to have not successfully demonstrated meaningful use, your incentive payments will be adjusted. So in other words, they will take back any money if they feel that you have not met the meaningful use measures. The Medicaid incentive is a little different. It offers up to $66,750 over a 6-year period. They will provide incentive payments to eligible professionals or hospitals as they adopt, implement, upgrade, or demonstrate meaningful use of a certified EHR in their first year of participation and demonstrate meaningful use for up to 5 remaining participation years. And there are no payment adjustments under this program. The important dates are also extremely important. They provide deadlines for you that you should remember. There is also an EHR incentive program timeline available on this page in the PDF format. Past the payment section. This section goes over the Medicare incentives in more detail. So if you have any questions on exactly what that involves, this is the part of the CMS EHR section that you should go to. This is the eligibility section. That's what this one looks like. The eligibility section actually goes over the requirements. There is also a eligibility calculator on that page. So if you don't know which one you're eligible for, then you could use that to calculate which one you should go with. The registration section page includes more information about registering. It includes some of the same information I included in the beginning of the presentation for you. The Certified EHR Technology page briefly explains your certified EHR technology, and there is a few other things on there to remember. So that deals with the incentive payments as well and how that involves your technology. The CMS EHR Meaningful Use section. This section goes over your meaningful use and the different stages. For example, we are in stage 1 of the meaningful use criteria, which is 2011 and 2012. This is the attestation page. This section explains the attestation process. This is one of the more important parts of that process, so you may want to go over this section in more detail as well. This is the Medicare and Medicaid EHR incentive section. This one explains the basics of the program. It includes a Medicare and Medicaid payment schedule. So if you want to know how your payments will be given to you, this is where you would want to go. Medicare Advantage. Now this section is for professionals who are employed by Medicare Advantage or are employed by a business or partner of an entity that is contracted with Medicare Advantage. So if that is the case, then this one pertains to you. Spotlight and upcoming events. This section includes some important dates and presentations as well, and there's even a link to Twitter. Educational materials. Now this section is very important. There's lots of information in here to help you. There is a short webinar on the registration process. There is an attestation calculator that gives you a score. If you don't pass it, then you can figure out what you need to do after that. There are attestation worksheets that are available, and there are user guides with step-by-step attestation instructions, which are very helpful. There's a comparison of the e-prescribing incentive versus the EHR incentive. You may want to explore these first because by testing you certify meaningful use, which means you're, just like we certified as an EHR, then you are now certifying that you have met all your meaningful use requirements. This is what the attestation calculator looks like. It can be used again to measure if you are meeting all your requirements. This is an example of the questions that they ask you. These are your core measures. These are the same questions that they will ask you in the attestation. So it's probably a good idea to do this first. The core measures ask for detailed information. The measures present an objective, the measure, exclusions if there are any, a numerator and a denominator. Now, the denominator represents the total number of patients included in the 90-day period